Oregon recently completed a data quality assessment on its emergency medical services data, and this assessment included the data reported by your EMS agency. The state generated an assessment report for your agency to review and take action on. This video will show you what's in the report and how to interpret the issues that may have been found in that report. In your data quality assessment, you'll see on the first page, it'll just list the number of patient care reports that were assessed and the time frame in which it was done. The report has two major sections. The data quality assessment looked at demographic data, which is information about your agency. And second, it looked at patient care report data. That's the data you typically think of when you think of EMS data. It's all the information about the runs that you go on. In the demographic data section, some agencies will see a message like this, that your agency has not submitted NEMSIS demographic data. So if that's the case, then your number one job here on the demographic data will be to work with your vendor to submit your agency demographic data to the state. This should be submitted on a regular basis, especially whenever anything in your agency changes, like your personnel list, your vehicles, etc. If your agency has submitted demographic data, then you'll receive a lot of information in your report about the data quality of that data. First, you'll see a section about XML schema validation. This shows if your data has any issues complying with the underlying structure of the NEMSIS data standard. It's rare to have issues here, but some agencies will have issues in XML schema validation. These messages tend to be fairly cryptic in nature. So if you do have some XML schema validation issues, we recommend that you work with your vendor. They can help you figure out exactly what caused the issue and how to address it. Next, you'll see validation rule issues. There are validation rules at both the national level and the state of Oregon level regarding your demographic data. And as you look at these rule issues, you will find some that are marked as an error in their severity and some that are marked as warnings. Prioritize the errors first. If you submitted data with errors, then your data was rejected by the state system and not processed. So those errors must be addressed. If you submitted data with warnings, your data was accepted by the state system and it was processed, but there's room for completing blank information and taking care of those issues. In this example, this agency had an error that happened 35 times where they had personnel with no state license number. You'll see that many of the issues in schematron validation of your agency demographic data are due to things like this, just simply missing a piece of information. So in this case, all you'll need to do is look up each of the people listed in this report and fill in their state license number. There are several other errors and warnings that could happen in schematron validation, but they typically come down to this sort of issue where simply filling in some missing information or correcting something that's wrong will take care of the issue. Next, you'll see a section about required elements. This will list any data elements that the state of Oregon collects in demographic data, but they were never filled out in your demographic data from your agency. For example, in this agency, they didn't fill out their annual statistical year information, and they didn't provide their agency contact info. Next is the procedures list. This section will list any procedures that your agency reports that it uses at various license levels that are not on the statewide procedure list. For example, this particular agency reports that indirect laryngoscopy is used by their EMRs, EMTs, AEMTs, and intermediates. On the statewide list, indirect laryngoscopy is only on the paramedic list. So this agency can resolve this particular issue by removing indirect laryngoscopy from the procedure lists for its lower licensure levels below paramedic. If you'd like to know what the full list of procedures is from the state of Oregon, you can visit the NEMSIS website at nemsis.org. Scroll down the page until you see the map of the US and then click on the state of Oregon. When you do, you'll see a section on Oregon's page called NEMSIS v3 Implementation Tools. Click on the state data set. And when you're in the state data set, you'll see an entry for procedures permitted by the state. This is the authoritative list of procedures from the state of Oregon by license level. And you can compare the procedure list in your software to this list of procedures here. The same is true for medications. Your data quality assessment will have a section regarding any medications that you say you carry at various levels and whether those medications are on the statewide list for those levels. So you can visit the medications permitted by the state in the state data set to see that reference list as well. Both procedures and medications can be addressed by simply removing procedures or meds from your license levels that are not actually performed by those license levels. Now, it is possible that you carry a medication or you perform a procedure at a particular license level that is not recognized statewide, and that's okay. If there's a few differences, that's fine if it's what you really do. Next, you'll see the list of facility issues. In this particular agency, we see that they have used different names for their hospitals than the official names reported in the state data set. So for example here, this agency would need to rename GSH to Good Samaritan Regional Medical Center in their agency setup to resolve that particular issue. Again, if you'd like to see the complete list of hospitals that the state recognizes, you can visit the state data set and go to the Facilities tab to get that list of hospitals. If your agency goes to other places besides hospitals, the state doesn't regulate those names or numbers. You can use whatever you'd like. But the state asks that you use the location codes and the names exactly as provided by the state for the hospitals in Oregon. That concludes the demographic data half of your data quality assessment. As you address issues in demographic data, if you're using a system other than the Oregon State Image Trend Elite system, then you'll need to resubmit your demographic data to the state of Oregon in order to have all of those issues that you addressed actually resolved in the state system. So remember to resubmit your demographic data on a regular basis as changes happen in your agency. If you're an agency that's directly using the state of Oregon Image Trend Elite system, you'll be addressing these issues in the same way in your demographic data in your agency setup. However, since you're directly using the state system, you won't need to do anything to resubmit your data since it's already in the state system. The second half of the data quality assessment is about your patient care report data. And it will look at several areas similar to the demographic data, but this time looking at the 911 calls and other EMS calls that you've been going on and looking at the data in those patient care reports. First, you'll see a section that indicates if there were any XML schema validation errors. And for most agencies in the state, there were no errors during the time period that was assessed. If you did have some schema validation errors, again, those messages are kind of cryptic, so get in touch with your vendor or Oregon EMS data staff. They'll be happy to help you interpret and resolve those XSD validation failures. Next, you'll see a section on validation rules. So here we can see that a number of patient care reports were submitted by this particular agency during the time period that was assessed. And we have a list of the most common errors first, followed by the most common warnings in schematron validation for the patient care reports submitted by this agency. Typically, it's not very easy to go back and resolve these errors in past patient care reports unless there's a really widespread issue that was maybe caused by a software configuration. Your priority here should be going forward, making sure that you resolve and prevent these errors from happening on future patient care reports, and chipping away at the most common warnings on your future patient care reports. For example, the first error message for this particular agency happened 6 times, and it said reason for choosing destination should be recorded when incident patient disposition is with transport or patient treated transported by the CMS unit. So this can be resolved on future PCRs by ensuring that whenever you transport, you record a value for the data element called reason for choosing destination. The next error is similar to that. Type of destination should be recorded on those same types of calls. After that, we see the warnings. The most common warning here in this agency was that AED use prior to EMS arrival should only be recorded when cardiac arrest is yes. So they had a bunch of patient care reports where they talked about AED use prior to EMS arrival, even though there was not actually a cardiac arrest on the call. And so that again can be resolved through education and potentially making sure that these warnings are being shown to the people who are entering the patient care reports at the time of data entry. And these can be addressed and improved over time. The next section talks about custom elements. Oregon adopted some custom data elements in the NEMSIS standard in 2020 with the response to COVID-19. If your agency has implemented these custom elements or custom values that were adopted by the state, then you'll see that indicated here. So this particular agency has implemented a new custom value for destination team pre-arrival alert or activation. They've also implemented the custom values for personal protective equipment used, but they have not implemented the custom data elements for recent travel. So you can talk with your vendor. They should support these custom elements, and they can help you figure out how to make sure that these elements or values are available in your data entry form so that your users can use them when they're filling out patient care reports. If you're directly using the state system, make sure that these data elements are on your data entry form. If you'd like all the details about the custom data elements adopted by Oregon, you can visit, again, the Oregon State Data Set, go to the Custom Elements menu item, and you can get all those details about each custom element. The next section of the patient care report data analysis is fairly lengthy. It lists all of the data elements collected by the state of Oregon. So those are all the elements that Oregon has asked agencies to collect and submit. And for each element, it shows you how completely that was recorded on your patient care reports. In this agency, we can see that they did 100% on these first few data elements. However, on type of dispatch delay, it was only recorded on about 10% of their calls, whereas statewide, it's recorded on nearly half of calls. So the blue bar is your agency, and the gray bar behind it is the statewide average. We recommend that you focus on the data elements where the average for your agency is significantly lower than the statewide average. You might want to make sure that those data elements are turned on in your data entry form. You also might want to make sure that they're in a place that's easy for your crews to find when they're filling out patient care reports. And you might consider a validation warning if those elements are not filled out in certain cases. It's not expected that you're going to fill out every data element on 100% of all calls. So you can prioritize the ones where there's a significant gap compared to the rest of the state. And you'll also be able to look through this list and see areas where your agency is doing really well compared to the rest of the state. And that's fantastic. If you'd like the full list of data elements, those are also available in Oregon's state data set file in the state collected elements menu item. The next section addresses data system performance measures. Oregon has adopted several data system performance measures that are tracked on a monthly basis at the state level to track how the EMS data system itself is doing. This section of the report shows how your agency did on these performance measures compared to the rest of the state. We can see that this particular agency is performing well on many of them, especially very well on patient age recorded and primary impression recorded. On the other hand, this agency is performing lower than the rest of the state on additional response mode descriptors recorded. So that's an area that the agency could focus on for potential improvement. If you'd like to get all the details about the data system performance measures, how they're calculated, what they mean, you can visit the EMS and Trauma Systems website through the Oregon Health Authority. Go to the Oregon EMS Information System webpage. Scroll down that webpage and you'll see a section called Performance Measures. From there, you can get a link to the performance measure definitions with all those details. And you can also find a performance measures progress report. This is what the definitions document looks like. And this is what the progress report looks like. There's a chart for each of these performance measures with performance over the past couple of years at the statewide level. So you can compare your agency performance to these statewide charts and focus on areas where you might want to make some improvements. The last two pieces of the patient care report section of your data quality assessment have to do with record completeness. This chart shows you completeness by incident date. What you'll want to look for here are any significant gaps of a day, a week, a month. If you see a big white gap somewhere in this chart, it tells you that the state system is missing a period of your patient care reports. That usually means that something broke down in the transmission of data from your system to the state system. You can go into your system, resubmit those reports, get them over to the state, and that will fill in that gap. And finally, you can take a look at your reports by incident time of day and compare it to the statewide curve. So the blue curve is your agency, the gray curve is the state. And in this case, this agency has a similar breakdown of their calls by time of day to the rest of the state, which would be expected. Okay, so here's what you can do. You can solve many of the issues that you find in your data quality assessment by simply addressing missing or incorrect information, just filling out some information that wasn't there or making some fixes to some wrong information. Your vendor can help you with all of this process. In fact, your vendor has a copy of your data quality assessment report. So if you have a question about it and you want to discuss it with your vendor, you can tell them, hey, I'm looking at my data quality assessment from the state of Oregon. I see on page 9, there's this issue XYZ. The vendor can bring up their copy of your report, go to page 9, see issue XYZ, and help you understand and resolve that issue. And finally, you can contact the state EMS data systems staff, and they'll be happy to help you understand how to address issues in your data quality assessment. Back on the Oregon EMS data website, if you scroll down the page, just above the performance measures section, you'll see a section called Access and Data Requests. And there is a link to a form request there that you can use for submitting support requests to the state. So if you have any questions on your data quality assessment, feel free to use that request form to submit your question, and state staff will get in touch with you to answer those questions. Thank you for reviewing your data quality assessment and taking action on it. Thank you for all the hard work you do to gather and submit EMS data to the state of Oregon. And mostly, thank you for all the hard work you do to care for patients in the state of Oregon and ensure that they have better outcomes as a result of your being there.